Welcome to everyone listening in to this LinkedIn live session. My name is Kimpen. I'm the Chief Medical Officer at Philips, and I am very pleased to be joined today by Jennifer Franke. She is Head of Medical Office Cardiology based in Germany, part of our DACH market. We are here today to discuss the results of the latest piece of the Future Health Index, the 2020 version of our research. The Future Health Index Insights is part of our 2020 release of the Future Health Index. COVID-19 and younger healthcare professionals were surveyed for this Future Health 2020 report. We captured their feedback. We captured feedback of 500 doctors under the age of 40 in 5 countries: the United States of America, China, Singapore, France, and Germany. The findings reveal how the COVID-19 pandemic has affected the attitudes and the experiences of younger doctors and how they believe the healthcare industry should change in response. I will have a dialogue with Jennifer, but if you have questions, please post them in the conversation box during this live session, and we will try to answer some of them during the session and the rest offline afterwards. But first, Jennifer, welcome today. It's a pleasure to have you here with us. Could you maybe introduce yourself briefly?
Thank you, Jan. I mean, it's really wonderful to connect with you today and with all the viewers who will listen to us. So my name is Jennifer Franke. I studied medicine and health economics, and I'm a cardiologist by training. I worked clinically and in research for about 10 years at a university hospital in Germany. And like you said, since January, I'm the head of the medical office cardiology in Germany, Austria, Switzerland.
Thank you, Jennifer. Let's dive in for the next 20 minutes and look to the 3 big topics of this extra edition of the Future Health Index. And first, let's look at the commitment to their careers as surveyed in these 500 young healthcare professionals. And what the data showed us is that despite the challenging conditions they are working in now, the majority of young doctors, they want to stay in medicine. 53% said that the COVID-19 pandemic during their work has not had so much effect on their desire to stay or leave in medicine. But 38% said they were more incentivized to stay in medicine. And only 9% told us that COVID-19 gave them ideas about leaving the profession. Now, I find that truly remarkable, as there is a lot of fear that people would leave the profession for good because of this COVID crisis. And I feel I share that fear. Jennifer, do you recognize this trend also in your field of expertise and in Germany specifically?
Yeah, that's, I mean, yes, indeed, I can really relate to that. I've spoken to many colleagues and they have described that working with COVID-19 patients or working at COVID-19 designated hospitals, that has been the hardest things in their lives, in their professional careers so far. In all these countries around the world, you see professionals at the same time really stepping up to this new responsibility. I can think of one example. For example, in the UK, when doctors and nurses there felt that the surge of COVID-19 patients was just about to arrive to the UK, so some weeks before, they really scrambled to prepare protocols on how to best treat patients with this novel disease that they were unfamiliar with, right? So they gathered all the knowledge that was available to them at that time to prepare. And in hindsight, many said that also eased the psychological pressure and the panic that they felt at that time. So I think it was a time of everyone needing to be agile and needing to be really effective to make clear decisions on which patients really had to go into hospital, really had to be seen in the outpatient clinic in follow-up, and with whom you could use a different method, a virtual method to take care of them.
Yeah, we all realize, I think, and we all have so much respect for all these young people that are putting themselves in harm's way, working with this vast amount of very, very sick patients. And despite these challenges and sacrifices they have to make, they still want to remain in this profession. What do you think that these people motivate to stay on?
Yeah, I think it might be surprising at first glance, right? Because you feel all the pressures and the sacrifices, physicians having to live in hotels and not seeing their families for many weeks. I mean, there are many stories around that, and many impressions on family members. But still, I think what is very surprising is that there's also a feeling of joy and even guilt, because you are being part of a very special team, and this newly created team spirit gives the profession or professions in medicine a new level of meaning and purpose to the work, especially for young professionals in medicine. Their tasks become much more clear and concrete. And for example, many interns who would typically maybe just typically shadow a more senior physician or a more senior nurse, they stepped up and had to demonstrate true leadership.
Yeah. I think also, and I don't know if that resonates with you, but the fact that 44% of these young healthcare professionals told us that they felt more respected by their patients contributed to their motivation. Would you agree with that?
Yeah, I think all of this became just more clear, and their tasks became very, very concrete. Lots of the stuff you have to deal with at the hospital, it sheds away, and what is left behind is really core medical tasks, I guess.
Yeah.
That does leave an impression on people. Yeah.
Yeah, I agree with that, and that is maybe a good segue into the second part of our analysis this time, is the new ways of working that young healthcare professionals are craving. And we studied or surveyed that also in the big report, the Future Health Index 2020 report that we published in the beginning of the year. Now, this part of the report, a new one, shows that younger doctors want a more collaborative, digitally enabled workspace. And indeed, that was also clear from the original 2020 Future Health Index survey. But it seems that COVID-19 has reinforced this. 44% reported a greater collaboration with colleagues across skill sets, which is something that I, as a young doctor, would have craved for also. And 44% said that they were exposed to new ways of using digital health technologies. Furthermore, younger doctors see new ways of working with technology as an important change that must become permanent. The top changes in healthcare that should remain, according to them, beyond the academic, were, first of all, accelerated availability of digital health technologies. 1/4 of the surveyed young healthcare professionals told us that. Exposure to new ways of using digital technologies, so not only the availability, but also the new ways of using them. And lastly, the exposure to completely new types of digital technologies. Now, if I ask you, as a young doctor yourself, what digital health technologies do you think will have the most impact over the coming years to help improving patient outcomes and the patient experiences?
Well, I think in the near future, we will see 3 bigger groups of technologies really arising and becoming standard. I think the first to mention is very easy. That would be telehealth. I really do hope personally that this will be considered the minimal standard in many countries as a way to prepare for any difficult situation. I mean, many patients, no matter which disease they suffer from, no matter which disease state they are in, they become anxious to come to hospital, and healthcare workers who have a long relationship and trusted relationship with these patients would also like to protect the most vulnerable and have a way to keep them outside of the conventional in-hospital standard visit. I think a part of telehealth is also tele-ICU, so tele-intensive care. If you have a hospital that allows the highest standards of intensive care, you can be able to step up and spread this to other hospitals and spread your knowledge in critical care via this kind of technology. So I think that's also a very kind of telehealth. Yeah. Other kinds of connected care are really important. Any smart technology that would help the easy integration of healthcare data between hospitals and other kinds of clinical practices. That also allows to put together clinical guidance, put it quickly into daily practice. A colleague of mine from the UK said that those hospitals did best that were already connected in networks, meaning that those hospitals did not do good who weren't connected in networks. And I think the third is, of course, artificial intelligence in healthcare. I do hope that isn't slowed down through the pandemic. I don't see that happening. I think, in my view, artificial intelligence is our chance to integrate cognitively all the health data that is there that we can capture today, and even more that we can capture tomorrow. Having a view on biomarkers.
Maybe let's park that artificial intelligence topic for a minute, because I have one additional question here. You talked about a lot of digital tools that are that you hope will stay with us also after COVID-19. But in the original Future Health Index report in the beginning of the year, we learned that almost half of the young healthcare professionals felt that their education and their training was not setting them up for success when they were in real life, especially with respect to the bureaucracy that is needed, the administrative duties, and the digital solutions. So would you change the training of young doctors also, now that you know how these digital tools can help in pandemics like this one?
I think it's very important, because luckily we're in the situation of these young medical professionals. They bring with them the affinity, right? They bring with them the affinity to adapt to these newer technologies. They have the basic knowledge of how to get used to them. So part of the training should be to set up strategies for them and with them, how to adopt more quicker and how to integrate these new technologies on the basis of evidence-based health interventions, and with this change daily practice within the specific setting as needed.
Yeah. So there is a big task ahead there for educators and universities training medical professionals going forward. Now, for everybody listening in the call, please, if you have questions, post them in the conversation box, and we will try to answer them at the end of this dialogue. And we will dive into the third topic. And that relates to what we postponed a little bit a few minutes ago. It's the artificial intelligence topic. So the third topic that we had in this extra edition of the Future Health Index was the attitude to relative benefits of these different health technologies. And before COVID-19, artificial intelligence, AI, was seen by the people we surveyed at that point in time as one of the most useful healthcare technologies. This was eminent in the original Future Health Index 2020 report. And now, during COVID, younger doctors see telehealth. 61% of them see telehealth as the top technology that would have improved their experience during the epidemic, compared to only 53% citing AI. So in a certain sense, telehealth took over the leading position over AI. And furthermore, and that was a little bit of the critical feedback the people in the last survey gave us, was the effective use of data, which remain a crucial hurdle. 93% of these young doctors said they were unable to leverage health data to its fullest extent during the epidemic, because they had problems with interoperability, they had problems with sharing of data, and they had also problems with a lot of data coming their way that were not really actionable. So better integration of healthcare data between hospitals and practices, and guidance on the appropriate use of these data, were cited as key initiatives to improve the interoperability. Now, since telehealth is such a hot topic lately and has become even hotter during the COVID-19 crisis, do you think this is just a next hype, or is it here to stay? What is your opinion on it? I read so many various views on it in the literature.
Well, in my view, it's here to stay. It's the technology that allows us to broaden the medical scope, to really reach everyone. By saying that, I really mean that on a global level. And at the same time, I think it also forces us, this new technology allows us or forces us to rethink who really needs to, be treated in hospital, who really has to, find a parking lot, go there, go to the outpatient clinic, maybe have some waiting time. If you take me as a cardiologist, if you take the standard heart failure stable patient, there are many ways through these digital technologies how we can keep an eye on them and make sure that they're fine and look at their, optimize their medication. But at the same time, I think it will always supplement, personal care. It will supplement, if you think of the more severe, more end stage cardiac patient, you will need this private and personal communication with the patient and with their loved ones. This will never go away.
No, I think that's that's very nice to hear from you as a young doctor yourself, because what we also heard from the young healthcare professionals, nurses and doctors in the original report as well as now was that they were inspired to work in a smart hospital system. And we define smart as a hospital where the human factor was seamlessly connected to the digital tooling that they had at their disposal, and not disconnected, but really integrated in their workflow. Now, although I like this conversation a lot, Jennifer, we have to go over to the questions that are coming in the box here. So please, everybody listening in, come with your questions, and we try to deal with them in the next 8 to 10 minutes or so. If we cannot answer all the questions during this live event, we will get back to them afterwards. First question coming in, Jennifer, what exactly are the digital tools that could help the doctors during this crisis, but also beyond this crisis? We have talked a lot about how they could help better patient care, but how could they help feeling doctors more comfortable in their environment? What do you think?
Well, I think one thing that we often hear in conversations is the administrative work and perhaps the frustration through potential mistakes in administrative work. I mean, wouldn't it be nice, for example, if you have a smart hospital doing your ward round while you're having your important conversation during the ward round with the patient? Wouldn't it be nice that the nurse already knows which medical changes you have taken, which changes you have taken to the dosage of their medication? Wouldn't it be nice to have a clear, documentation of this that doesn't allow for these kinds of mistakes? And those are, I think, help in general. Anything that improves patient outcomes. I mean, getting all the knowledge together. I think as a doctor, any human being, we're not capable of gathering all the information. And if we really want to implement the science that we have, the clinical science, the clinical knowledge that we have as soon as possible, we need AI, I'll say it again. We need AI. We also need other ways of connected care to get this knowledge to the patient in need and to the doctor.
Yeah. There is another very interesting question coming up here, and that is, how do we start understanding when digital should go face-to-face? When is digital enough, and when is face-to-face absolutely necessary? Is that only in the clinical decision making, or are there other areas where you say, okay, this can be done digitally, but this you really need to do face-to-face and keep doing face-to-face?
Yeah, I think the example I mentioned before, the end-stage heart failure patient, I think that's someone during the pandemic you would really have wanted to see, you really still wanted to see. it could be different in different diseases. But I think these really important conversations where you connect with family members, where you maybe even, trust building in the very beginning. But the standard stable patient, there could be chances where you also have to do that very personally, but I think typically that would be something that would be moved out to telehealth.
Mm-hmm.
Perhaps always depends on the situation.
Yeah, and maybe a follow-up question by myself. I have worked as a doctor for a long time, and I felt especially the dialogues on severity of disease, end of life dialogues with patients. Do you feel that this could be taken over by digital tools, or is that something really that we have to do face to face?
I would always see that face to face. My personal view, I think any digital tool should have the goal to make more space for the human element of medicine, especially in end-stage diseases, but also a very specific procedure that, where you have to explain many things. I really see the physician in front of the patient with a 3D model explaining what will be done the next day or the next week. That would be my wish.
I think we have to realize that I heard a lot of doctors, but also healthcare administrators and CEOs of hospitals say that this was the most painful thing they had to do was to isolate patients who were dying from COVID, and they could not let the family in the room. And a very touching example I heard in a news show last week is that a CEO of a big healthcare center told the journalist, he said, listen, we have wonderful doctors and wonderful nurses that can hold the hand of a dying patient, but it's not the same hand as his daughter or his wife. And that was in a very small example, really what is happening. So let's keep that face to face and try to do other things digitally. Let's go to the next question. While there is a clear opportunity for technology and AI in healthcare, what would you say are the biggest risks to consider? Could you talk a little bit on the risks that are associated with a more extensive use of technology and AI?
Well, I think the quality check of the source has to be guaranteed. I think when we gather all the information, most health information comes from the patient themselves, of course. But how do we track this? Which algorithms, which quality is behind the algorithms? Which evidence base is behind these algorithms? This has to be clear. Coming back to the training of young doctors, I think this has to be part of the training, understanding what makes high quality in these new technologies. And I think anything that drags us away from the human element, any digital technology that brings us to where we don't want to be. Our goal should always be to make more space for the human element by these digital technologies. I think this double check is really important, and that's a risk.
Let's go and talk a little bit on the shortage of healthcare professionals. We read that in the newspapers that almost in every country there is a shortage of people working in healthcare at the bedside, both doctors as well as nurses. Do you think that the crisis that these young healthcare professionals are in now, and it seems to be better during COVID than before COVID, is rather caused by the shortage, by the very heavy hours they have to make, or is there another reason why they feel less incentivized to stay on in the job as before?
The long hours, it's almost considered a tradition in medicine. I visited many hospitals around the world. I see that this is different in many countries. If you compare Singapore to North European countries, you see different working hours. So this is something about work culture, I say. But in the end, medicine is always a profession of purpose and meaning, and I think that's what attracts people to medicine always. Yeah. So I'm still fascinated about it. I never thought it was a mistake. Yeah.
It's nice. It's nice to hear that, and it's good to focus probably on the two things. First of all, get as many enthusiastic and motivated people in the hospitals taking care of patients, and at the same time motivate them even more by bringing the right digital tools to them to do their work better. It has been a great conversation, but I am afraid that we have to wrap up this session. It's all that we had to discuss today. Thank you very, very much, Jennifer, for joining me here. And thank you everyone for tuning in. I really, really enjoyed this conversation where we talked, Jennifer and me, but also everybody that contributed in the chat about the Future Health Index Insights reports, looking at how COVID-19 pandemic has affected the attitude and the experiences of younger doctors and younger nurses. As we have seen, in summary, many younger doctors are as committed to healthcare as before and before the pandemic, which is remarkable. Younger doctors want a more collaborative, digitally enabled workspace, what we would call a smart workplace. And telehealth is the top technology that would have improved their experience even more during the pandemic. I apologize for not having answered all the questions that came in via the chat box, but we will try to get back to you and provide the answers offline to as many questions as possible after this session. If you want to learn more about the Future Health Index and download all the available reports and assets, visit the Future Health Index website and you have all the materials available there. Thank you very much for listening in.